various forms of Durga. We have come across various forms, and one of the most popular forms is the one in which she is saving life all the time. And one of this particular form is very popular when you see her in the form of a doctor, somebody who can help you come out of various situations, and somebody who can save your life at various situations. So here in this particular society and across the world, we have seen that doctors hold a special place in our heart. And we have got somebody very special who not only does something very, very amazing for multiple people, but has been very instrumental in saving multiple lives and also bringing in few beautiful lives in this world. It's an absolute pleasure for me to have Dr. Tushna Kanga Menon joining us this conversation.
Thank
Hello,
you. Thank you so much. Thank you for having me on this platform with you today.
Tushna, how has been your journey so far?
My journey so far has been excellent. I have enjoyed every part of it. I have enjoyed being here and coming and reaching where I am today. So from the college days to medicine to becoming a gynac, to working in rural India for 1.5 years, which was one of the most amazing parts of what I am today, and taught me a lot regarding women's health. All that encompassing practicing in Mumbai, which is a metropolitan city, is all great.
Awesome. You make things look so simple, Tushna, right? But life doesn't happen so really, right? So we know what it makes to get a medical seat, beyond that medical seat, then a PG seat, right? PG seat, then beyond establishing yourself, getting you to the best of the hospitals, things don't come that easily. So be little kind to us and explore a little bit more.
So, okay, so if you want to know the whole journey, so after I finished my medicine and I did my post-graduation from Somaya Hospital, I was working in Bhabha Hospital, which is a municipal hospital in Bandra, where I was working as a senior registrar. Also, after I finished and got my degree, me and my husband both were practicing in a place called Bachao in Kutch, which is rural India. Which is actually very rural at that point of time. We were there for 1.5 years. And I was the only gynecologist in an area of around 280 kilometers around. There was nobody else. So that part was excellent. After that, coming to Bombay and coming back to Mumbai, which is where I am from, and studying further into special parts of gynecology where I have practiced further, which is endoscopy or laparoscopy, high risk obstetrics, cosmetic or functional gynecology. I have certified in all these things which are further into gynecology, further in-depth fields of gynecology. That's it. Getting all these things, obviously it's hard work. It's also a lot of luck to be at the right place at the right time. But it's been fun. It's been a lot of blessings, help from my seniors, from my bosses, telling us what to do, how to go ahead, and family and friends like you.
Beautiful. The thing that about the gynecology, when you look at the field, it is something which is very vast, but a lot of times I feel that this is one particular field that is not so very openly discussed. I have seen a lot of conversations within the families that don't really happen. A lot of visits to gynecologists are not discussed in the family, right? So a lot of these things happen, and particularly when earlier when we had the larger joint families together, wherein there were seniors working and dealing with the kids and with the youngsters, guiding the young mothers as well as the kids growing up. That was a different part, but whereas we see in the nuclear families today, the things are very different. So what do you think needs to change at this, based on the family structure? How do you promote an open dialogue?
So the most important thing that I tell everybody who comes to me, whether it is a mother coming to me to talk to about her daughter, or a husband and wife, which is a couple coming together, the most important thing is that when you want to start an open dialogue in the family, it needs to start from a very young age. So for example, in my family, when I started with apparently a very taboo topic in India, which is the periods. And when we talk about our menstrual cycle, it's not considered something that is discussed openly. If you had noticed, and if you have noticed over a period of time, when you go to the chemist, initially you used to get the sanitary pads wrapped in black color plastic bags, or brown color paper bag, so nobody knows, nobody can see what you're taking. But today, if you go to a chemist, you can openly ask for a sanitary pad and they just give it to you. That whole thing of hiding it is luckily gone. To start open dialogue, it is very important that the parents start the open dialogue with their children. And I'm not only saying daughters, it is daughters and sons both. The boy also needs to know what his sister or his friend is going to go through in those formative years. And if he knows what it is, he knows how to be empathetic towards them, how to understand what they are going through. That is how open dialogue starts. He's going to have an open dialogue with his wife, with his daughter in the near future. And that is the best part. So in today's day and age, which is a very good thing, is that you see open dialogue amongst the young generation. The young generation speaks very openly about their menstrual cycles, about everything related to their gynac health, which is their maybe even their sexual health, maybe going ahead and talking about their boyfriends, their girlfriends openly with their parents, which is excellent. Because if you can come back and talk to your parents and your family about what you're going through, it takes away a lot of issues which the teenagers or the young minds of today are facing. And in today's day and age, we don't see, like we were talking about the periods, we don't see periods coming only at the age of 13 and 12 or 14 that we used to. I have girls as young as 7 and 8 who are getting their cycles. So for them to understand, their fathers need to be open to the fact that they can talk about the menstrual cycle, they can talk about what they're going through, the pain, the bleeding, everything in a very non-embarrassing manner, in a non-shameful manner. So to start open dialogue, it has to be from a young age. And in today's family, the men have to take the step ahead and say, there's nothing wrong to discuss it in an open forum, whether it's in between grandparents or in between aunts and uncles. It should not be a taboo topic. It should not be something that you're ashamed of. And that is the most important thing.
Absolutely. Going forward, what we see currently, the population, the youngsters today also travel a lot based on their work requirement. They are at different places. These particular things, they open their environment. The conversation lead to different relationships that get developed, and which subsequently move into, some of them go towards marriage, some of them don't realize into marriage, and then a lot of complications that come around this particular part, right? So how critical it is for this particular age group, say around anywhere between, say, about 24, 22, 23, when they come till the time they get married, because the age of marriage is getting pushed up. So between 20 to 32 kind of people, how important it is for them to be open in these conversations?
Extremely, extremely. And the good part is that a lot of them actually are. A lot of them come forward on their own, get to a gynecologist, like to meet one of us, to talk about the different contraceptives that they can use, because it's the whole concept of getting into a relationship only post marriage is not valid anymore. And the earlier we as parents learn to accept it, the easier it will be on our children to also understand their limitations and what they should do or they shouldn't do, and what they can talk about and how to go ahead and how to protect themselves. If their family can tell them first, then that's like the most amazing thing. So today I do have a lot of young girls and boys who come to me to learn about contraception, to learn how they can keep themselves safe, to learn what is good about having multiple partners, single partners, how do you go ahead there to discuss their own sexuality, whether it is how they feel about the opposite sex or the same sex. It is something that is discussed very freely and openly. Unfortunately, we still have a lot of people in our society, including doctors, who do not speak about it that openly, who do not allow that open conversation even with patients. So, but that is slowly changing with the younger generation coming in, and the senior doctors understanding that these things do need to be discussed very easily. So it is very, very important. Pre-marriage counseling is very important to understand. what it is. It's pre-marriage counseling does not only entail a gynecologist, but it also entails a psychologist, and together they can actually help a couple understand a lot of things before they enter that phase of their lives, which is amazing, which is beautiful.
Sure. So the stage that comes after this, because of the late marriage, is also often discusses about the late pregnancies,
Right.
and conventionally the time wherein you had the childbirth as early as about even 20ish, to the time wherein this generation getting married in their 30s. Then there are a lot of other complications happen. So these so I don't want to use the wrong term, but what I realized in this particular part is that there are a lot of socio physical combination that happens, which subsequently lead to these couples getting stressed,
Right.
to say the least. So
So,
how do they look at it? How they can approach you? What are the things that are available for these couples now?
young couples so there are different couples that we're talking about. There are couples who want to discuss what it is not to have a baby because maybe they're not interested in continuing a family, which is absolutely fine, absolutely fair, and there's no right or wrong. So they come to me to understand how can they go ahead with their life in a different manner. At the same time, there are couples who come to us with who are planning on getting married 3-4 years later and planning a family maybe 3-4 years after that. So discussing something called as egg freezing with the couple, where we give them the option of young mothers, young girls freezing their eggs so that they do not face fertility issues as they progress, as they get older. So egg freezing is something which has to be told to the young girls, because a lot of them come to us at 37 and 38 talking about egg freezing. It's not that it's not possible, but obviously I would have preferred a 28-year-old asking me about egg freezing than a 38-year-old asking me about egg freezing, because I'll just be able to help her better. And the fertility issues, yes, we are dealing with a lot of fertility issues, much more than what we used to see or what our colleagues or seniors used to see even 10-15 years back. But that's got to do a lot with emotional, environmental factors, stress, financial stress that the couples are going through, the environmental toxins that we are all dealing with today, and the age. The average age of couples now getting pregnant is nearing 35. So, which is 35 pay. If you know, most of the mothers are at this age, you were though in school or you were though in college, and when I was 35, so but now their daughters and sons are ready to get parents, ready to become parents at 34, 35, which is not bad. It is just that they need to be explained that the biological clock still works the same way. So they need to understand that aspect of it, that if you do plan a late pregnancy, you could maybe deal with ABC, XYZ. You could require help in a certain format. You may have to deal with gynecologists to help you get pregnant with whatever modalities we have, like whether it's IUIs or IVF, pregnancies and everything like that. But saying all this, you also have couples who do get pregnant on their own at the age of 40 and 41 also. So it's not that it's not possible, which is a lot of thinking that a lot of couples have. 39 ho gaya, abhi not possible, chhod do. Nothing is not possible. So, but they need to know. Everybody needs to be given, you just basically need to have the correct knowledge so you can take the correct decisions.
The next phase naturally comes is the famous midlife crisis, right? So this particular midlife crisis has multiple angles, including the so many professional angles which are formally discussed without looking at the physical aspects which get discussed at that point in time. So my request would be to throw some light on those aspects.
So midlife crisis. Okay, so midlife crisis or menopause, as we call it for the women, and andropause, as we call it for the men. A lot of men still don't know that there's something called andropause does exist, and they also go through a little upheaval in their life, maybe at a different age and a stage. But so that is something which is very natural. It is a phase of a woman's life which she should embrace with a lot of love. Okay. Should look at all the positives that are coming out of it. For people who follow cultural stigmas of not entering a temple and not touching God when you have a period, planning their whole vacation, planning their whole going to a mandir, planning everything in a woman's life. For 70-75% of the women gets planned around what are my dates, and that is how I'm going to plan everything. When you enter menopause, just get up and go. There's no planning required, right? That's one of very, very big positive from menopause. So menopause is just a term. It's basically changes in the hormone levels of a woman's body undergo certain changes at certain periods of time. Today we are seeing those changes coming in as early as 40, 41 also, and they can cause a little difference in skin texture, mood disturbances, hair fall. A person who's suddenly chirpy starts suddenly becoming very low and not interested in talking and stuff like that. The family doesn't really understand what she's going through. The husband and the children feel ki mama has suddenly changed. She was all, mama is shouting at the smallest thing, mama is not understanding anything, mama is crying when she sees a serial. So all those kind of things. But there are a lucky few who very sail through menopause. Nothing happens to them. They don't go through anything, which is great. So it is not that everyone has to go through a lot of changes. A lot of my patients who come to me, I tell them that just because your friend went through these 10 points, not necessarily you have to go through them. So don't wait for them. Don't wait कि मुझे mood changes होगा या मेरे बाल झड़ने लगेंगे or something like that. You may not go through anything at all. So that is great. But it is a period which can last from say 4 to 6 months to even 4 years in and around the cycle stopping. So they just need to understand that it's a normal thing. We do have things and modalities to help them. Again, at this phase, again, psychologists play a very important role in understanding and helping women talk it through, understand what she's going through, help her out. So it's just a phase, and it's a phase that will pass. So that's what they need to understand.
Very simply put, it's a phase and that phase has to pass. But probably a lot gets discussed around this phase compared to that. I would like to understand what are the few changes that you would like to see in the society that wherein things would become more balanced, more open.
I would like society per se to obviously, like you said, to become more balanced and more open, to have open discussions regarding everything related to a woman and her health. She doesn't need to hide it anymore. She doesn't need to only speak about it when it's reached a peak where she cannot bear with it anymore. In the metropolitan cities, you're seeing this change happen dramatically, which is great. But unfortunately, in certain rural parts of India or certain interiors of India, these changes are not easily accepted because the women themselves don't easily accept them. They don't accept the fact that they can discuss these issues even with other women. So discussing it in the family where men are involved is a very big step for them to take. But slowly, I'm hoping that their children understand it. And that is how change, that is the best way to bring in change through our children, through making them understand what it is to respect each other, what it is to understand what we are all going through. From the gynac aspect, I would love for open discussions to happen around the menstrual cycles, love for open discussions to happen around menopause, love for open discussions to happen around something called as cosmetic gynecology, which is also something which, like initially, a woman wanted a breast implantation, or women wanted a nose job, or women wanted anything to do with plastic surgery. It was frowned upon because it was like, you want to make changes because you want to look more beautiful. No, not necessary. She may be wanting to make those changes because she just wants to feel good. Feeling good is also an aspect which should be accepted and should be allowed to do. There are a lot of things which men are slowly accepting, understanding, and embracing. That's the correct word I would like to say.
Thank you so much for these amazing insights, Tushna. I hope that the change that you're looking for happens soon. And
Of,
I hope to be a part of that particular change myself as well. Thank
of
you
course.
so much.
Thank you. Thank you for having me again. Thanks.
Thank you.